I want to get Dr. Narasimhan into the conversation. So clearly when you say that you will have the community health workers out there, close to where the people live, we have suggested in the book that there must be a systematic task shifting. Professor Subodh mentioned that a lot of people actually come to hospitals because they couldn't receive care closer to their home. So if the community health workers take care closer to their home, what are the tasks that you think they could be trained to perform? Now we know, for instance, that cardiac care is obviously leading in this whole NCD scourge. How do you see this playing out in delivering cardiac care, where you could have a cadre of frontline community health workers who work with a team of doctors, specialists, etc., and own the entire care continuum?
It's a very easily doable program. It can be scaled up. If you take, for example, a hub and spoke model, where they reach out to the villages or the community and they liaison with the primary care, who again liaisons with an apex tertiary care body, that's why. But I have a slightly different take on this. We have this notion that a specialist is someone who's superior. There's a very drastic decline in comprehensiveness of medicine. I'll give you two examples. There's no better example than a real life story. There is a CEO of a company, a technocrat, who comes to me for an expensive device placement for heart failure. He has gone through MRI, CT scan, angiogram, everything. And then he says he has gone through the internet, has a sheaf of material saying that I need this kind of a device, this is the best Medtronic device. So if everything is fine, you go through the guidelines. He has all the guidelines characteristics, that is, he has a heart failure, he has got a prolonged QRS, he has got all the tick boxes for requiring a device. The only thing was we made him lie down and checked his leg pulses. The pulses, that is the blood circulation into the leg, was absent. That is an indication that he was born with a condition called coarctation of aorta. No one has felt his pulse. All through he has gone to several hospitals, CT scan. Because if you look at the modern medicine, we think getting a CT, MRI, everything is glorified. We grossly underestimate the value of a comprehensive clinical care. In fact, he is the most important person in medicine. I'll give you another example. This Akhila's dad was a biochemist, and a student of his, a PhD from Coimbatore, same story, had a bypass surgery in Bangalore, one of the previous centers. All the grafts were occluded. 5 years later, he goes back to the surgeon. Surgeon says, I'll redo, put all the grafts again. And then he goes back to his cardiologist. He says, you may not benefit. Go and meet Narasimhan. All that we do was just look at his fingers. The finger has a telltale sign called clubbing, and he has got a little crackles in the lung, which is indicative of a primary lung disease, not a cardiac disease. Why? Because of a drug called Cardiologist, which he has been taking unsupervised for 6 years, which was supposed to be stopped after 6 weeks after surgery. He continued to take after 6 years. Now, he ended up in a lung transplant. He didn't make it. We are wrong. Completely, it's like a plane taking off. We are looking at the speed of arrival, not the direction of diagnosis. This is a serious problem in medicine. I'm sure if there's a practicing clinician, we celebrate lot of procedures. We celebrate hip replacement. We celebrate heart transplant. There are several heart transplants which can be prevented, completely prevented, if their blood sugar and blood pressure is adequately controlled, because he's an unsung hero. I'll give you an example. You take Sully. I'm sure all of you would have seen this famous movie Sully, where the captain lands on the Hudson River.
Right.
Now we celebrate Sullenberger as a very famous captain in the world. But if there is a captain, I would like to get into a flight where the captain had seen the lot of birds and refused to take off, delayed the flight by half an hour. He is a preventive. He should be the hero in medicine. So there's completely change, and I think we are hyped up because good physicians never celebrate or go around to the public kind of celebrating their victories. We have a serious sense of humility. If there is one thing medicine teaches us, it teaches us to be humble. It teaches us to accept mistakes and keep moving on. So, what is the technical advance? We somehow think that something technology, one additional lead, a tiny little surgery, comes up in the newspaper. But actually the unsung heroes are the medicine practicing clinicians, the nurses. For example, the nurse who's dealing with a respirator has got 10,000 controls with a respirator and a dialysis machine similar to a 707 aircraft. But her salary is 14,000, 10,000. So we grossly under this disparity that we see in terms of the salary, it's grossly inadequate. And somehow, if you show the incentive, we tend to incentivize the specialist care, grossly underestimating the value of a comprehensive good clinical care. Even in medicine, professional bodies celebrate someone who has done a heroic procedure. Never ever. Suppose a person comes and has prevented this COVID epidemic. He'll be an unsung hero.